Here are 3 things to notice in this rhythm review quiz from the other day. My name's Tyler, and I try to help new nurses read basic rhythms. Number 1, the rhythm is irregular. Not only that, but it's irregularly irregular. This means that we have no real way to guess where the next QRS complex is going to land. Number 2, the QRS complex is narrow, less than 0.12 seconds. This would suggest that we have an origin that's coming from somewhere above the ventricles. So this, of course, would leave us with either sinus, atrial, or junctional possibilities. And number 3, there are no discrete P waves. Now, at first glance, these small humps here may be tricky, but take a closer look. Those are actually the T waves. One thing we can do to help with this is to examine the relation to the QRS complex. And when we do, we can see that this gives us a consistent QT interval, which is helpful. Now compare this to some of the other potential responses. In sinus tachycardia with premature atrial complexes, we'd expect to see a regular underlying rhythm with isolated early beats occurring. With junctional rhythms, we typically expect these to march out routinely, since they're coming from a reliable pacemaker source in the heart. And finally, in second-degree type 1 heart blocks, we expect to see a progressive lengthening of a PR interval preceding dropped QRS complexes. So I hope this helps, and keep in mind everything that we're discussing is from a single lead basic rhythms perspective, and exceptions may exist in the real world.